afternoon, everyone. My name is Anuja, and I work as a data journalist for DataLEADS. This is going to be a lightning talk, and it's called Insights from the Internet. And as the name suggests, my colleague Motunrayo from Africa Czech and I will be sharing some insights from an initiative that we've been working on during the COVID-19 pandemic. Um, so on April 2nd, 2019, in the initial months of the pandemic, when there was a lot of medical misinformation online, Google launched a series of initiatives. I think they pledged about $6.5 billion to assist news organizations and journalists in fact checking medical misinformation. And the idea was that by providing journalists access to online searches or information on online search trends, they will be better able to develop content and essentially address any vectors of misinformation during the pandemic. We monitored two platforms. One is Google Trends, which is publicly available. You can just go and Google Trends. Broadly, it gives you a sense of what is trending online. And this is aggregated for a large population, either at a country level or a state level, or you can also look at global search trends. The second platform is called Question Hub. Now, this is not publicly available, but there is plenty of information about it online. So let's just look at some of these vectors or some of these insights that we found from monitoring these questions. Firstly, medicines and compounds, right? So obviously there was a lot of coverage about this in the press where people were self-medicating. There were several cases of deaths from self-medicating. And this was actually one of the most popular categories in which we received questions. So medicines would range from, medicines that have been approved for other conditions. So for example, people were kind of Googling the names of BP medication, heart medication, medication for allergies. So for example, as you can see on my slide, these are some of the different medicines that people search for. These are pretty much prescriptive drugs, but they've been prescribed for other conditions and not COVID. And then also drugs that are currently being researched or experimented for COVID-19 treatment, but there is no evidence that these medications work. So these are some that have been popularly covered in the news. There were a lot of questions on whether I can take remdesivir, HCQ, ivermectin. These were some of the popular drugs that were searched. And then we also had over-the-counter drugs which don't require prescriptions, but are commonly used as, let's say, vitamin supplements, heartburn, peptic ulcers. For example, again here, omnacortil is actually a steroid that's used for treating allergies, but people were Googling to see whether they can take these medications either as a preventative measure or as something that's curative for COVID-19 patients. But largely it was all preventative. People just wanted to find out if they can medicate themselves to avoid the risk of being infected. Now, one thing that I want to flag here is if you actually just try to think about why people are searching for these medications, like let's say why CoQ10 specifically, right? One thing that we found a lot is that people, when they sent in questions, they would say, okay, Monosef CV200 is working for cold infections, so why can't I use it for COVID-19? So this whole process of self-medicating also just involves people thinking about, okay, these are common drugs that I take for, let's say, treating acidity. If acidity is one of the symptoms of COVID, initially there were a lot of rumors, so should I take this to prevent any infection or even to cure COVID-19? So that becomes very dangerous, but it also provides a lot of insight on why are people searching for these drugs versus others. Moving on to the next category is the consumption of disinfectants and sanitizers. Now this is really, really dangerous because there were a lot of searches around whether people can directly consume, let's say, hand sanitizer. We've seen that being covered in the press, deaths from, consuming hand sanitizer. but also a lot of questions around sodium chloride solution, whether we can directly consume it, will it kill coronavirus inside the body. There was also titanium dioxide, which is actually a solvent used, in the production of paint. And there were people basically searching for whether they can self-medicate themselves with titanium dioxide. Also, a lot of questions around whether you can inject sanitizer. So these are extremely dangerous rumors that we've seen also leading, unfortunately, to a lot of deaths from misinformation. Another interesting thing is that we also received a lot of questions from doctors. So there were doctors basically filing in questions saying, can I prescribe this medication for a coronavirus patient? So for example, as you can see on my slide, these are just some questions around different procedures and whether they can be administered to COVID-19 patients. Now, that is a huge cause for concern if we have doctors actually searching for treatment online. But it's just, supportive evidence for something that we already know, which is that people actually resort to Google before they even reach out to a health practitioner. And this is extremely dangerous. Just on a related note was searches around alternative medicine, herbal cures. Again, this wasn't too much. I think Africa Check will talk about, some of the herbal cures that were actually trending a lot more in Africa. But in India, it was pretty much restricted to homeopathy. And basically, we would see that anytime Ayush Ministry would tweet about something, then people would immediately, there would be a surge in these kind of questions where people are like, what has the government said about taking homeopathy medicines? Where can I access this homeopathy drug that the Ayush Ministry tweeted about? Other home cures were like steaming and also consumption of turmeric. But these are, quite popular, and you'll see them, being shared on Facebook, etc. In India, another kind of trend that we saw was religious profiling, especially after the Tablighi Jamaat incident. The next day, we just saw a huge spike in questions related to Muslims and COVID-19. And these are just some questions that we received that are shown on my screen, which is, why do more Muslims have COVID-19? How many Muslim countries are affected by coronavirus? So these again are a huge cause for concern, but also are reflective of the fact that coverage on these issues must be dealt with in a more sensitive manner, because it does translate to people kind of stereotyping, making these assumptions, racial and religious profiling. And it's very, very evident. If you look at the data prior to the incident, a lot of people would search about how many COVID cases do I have in my locality, but then suddenly there was this huge interest in why more Muslims have COVID-19. Also questions from pregnant women, as well as, interestingly, rights during the lockdown. So we received a lot of questions on, what are the legal, what kind of legal action can I take if I'm being discriminated in my society for being COVID positive? Can my employer force me to work on the field during lockdown? Also, a lot of questions from medical professionals, nurses and doctors with underlying conditions who wanted to know, will I be fired if I want to opt out of serving in a COVID-19 ward because I have this underlying condition? So interestingly, all of these questions were being filed onto Google, which means that there were a lot of people who were looking for information around these topics, and that information was not available online. Then we also have, we also received, searches around symptoms. Again, this can be extremely useful for health authorities especially. So just symptoms around loss of smell and taste was trending online much before it was formally recognized as a symptom. Also rashes, not just on Question Hub, but also on Google Trends. There were people who were searching for, is having rashes, a symptom of COVID-19. Although it hasn't been recognized, it is currently, I think, identified as a possible symptom. Again, very practical questions around, what temperature is considered to be fever, and yeah. So again, these are very, very useful for health professionals to just, because if you think of it, when we experience something, we immediately Google it. So just having access to that information is very, very useful even for medical research, especially in the case of COVID-19. You just see the kind of demand there is for information on diets and fads, um, but at the same time it can also give you some information around public perception towards these diseases. So for example, with mental illness, right, uh, you might not receive questions around what medication should I take, but you will see a lot of questions around I'm feeling depressed. Is it out of bad luck? What is the difference between stress and illness? um, what can I do from a religious perspective to get rid of depression, right? So these are not just practical questions around what medications, but they can also inform medical authorities on the reasoning behind the, the thinking behind these diseases. Also, with communication from public authorities, they do have an impact. So, what you're tweeting from the Ayush Ministry handle, or what a popular public authority is tweeting, or what the President of the United States is tweeting, they receive a lot of attention, and people want to know if what they're saying is true or not. And finally, I think news coverage, the way you cover a topic, the way it's reported on social media, can have ramifications on the attitude that people have towards these issues. And overall, it's been an extremely interesting exercise to see what people search for when it comes to health. And I'll now hand it over to my colleague Motunrayo to share some insights from monitoring online search trends in Africa. Thank you.
My name is Motunrayo. I'm the Nigeria Deputy Editor at Africa Check. Africa Check is a non-profit fact-checking organization set up in 2012 to promote accuracy in public debate and the media in Africa. Our goal is to raise the quality of information available to society across the continent. We work in 4 countries: Kenya, Nigeria, Senegal, and South Africa. Before I dive into the topic for today, I want to acknowledge Google for granting us access to Google Trends and Question Hub. These platforms have given us an extra edge when it comes to knowing what questions Africans are asking about health. And they've also informed our editorial decisions as to what to focus on in Nigeria. We have produced and published fact-checking content that broadly speaks to the questions and trends we've seen on Question Hub and Google Trends. This includes content on face mask, malaria, stroke, sickle cell, herbal treatments, and general COVID-19 questions, including about symptoms and cures. Over time, we've noticed a growing shift from COVID-19 to other health issues. The salient fact here, and the fulcrum of my message today, is that people on the continent want answers. This is where the problem of medical misinformation comes in, as they are vulnerable if they don't get the right information. It is our job as fact checkers, journalists, and health experts to ensure that people are not misled. It still feels like it all happened yesterday, but in mid-2003, a group of religious and political leaders in northern Nigeria advised their followers not to have their children vaccinated against polio. They claimed that the vaccine would make them infertile and that the immunization drive was part of a Western-led plot to reduce the population in the Muslim world. Tests on the vaccine showed the claims were baseless, but the media still reported the claims without checking, and by the time they were withdrawn, the damage had been done, giving polio in the region a new lease of life. But thank goodness Nigeria has been declared free of wild polio by the World Health Organization, and it may be of interest that the polio setback is Africa's raison d'etre, our origin story. Now, what questions are people in Africa asking about health? Plenty. In April this year, they asked if COVID-19 has an expiry date, how long it takes for one to die after contracting the virus, and if catarrh or excess mucus is a symptom of COVID-19. They also asked what type of food should COVID-19 patients eat. Does Dettol or gasoline have any effect on coronavirus? Can one recover from COVID 19 without treatment? And is there a link between iodine and coronavirus? Then in July, we began to see more Herbal related questions. Africans wanted to know if lime and bicarbonate soda cures COVID 19. How about alkaline fruits? Can it be used to fight coronavirus? Does oil affect coronavirus? On the continent, traditional medicine retains an appeal due to a healthcare system that is weak and inaccessible. More recently, we've seen other questions around sickle cell, stroke, malaria. One person asks if sickle cell has a lifespan in the body. Another asks if snail water and milk can be used to treat stroke. Is there a cure for AIDS? And can one mix ginger, garlic, lemon, lime, honey to treat malaria and cough? These are just a few questions we pulled out. But each day, more and more questions are flagged to us on Question Hub. Information remains an everyday need to people on the continent. There is just so much we can do. I believe as we all come together to fight medical misinformation and ensure that the right information is provided to everyone, not just Africans, it would go a long way in saving a life. We may not be wrong to say that some of the questions I cited are coming from mothers who may not be able to afford adequate health care for their ailing children and are on the verge of falling for really wrong and deadly health advice, or from those generations on the other side of the digital divide, or young people just looking to make sense of the rapid changes caused by the pandemic. In short, everyone needs information. We have a duty to work together. Thank you very much. I look forward to the question and answer.
All right. Thank you so much, Motunrayo. It was interesting to also listen to some of the insights you had from Africa. So I think we have about 9 minutes for questions. We've received a few questions from participants. So let me ask you the first one. The question that we have here is, given the large volume of questions you were tracking, as a fact-checking organization, how did you prioritize what questions were fact-checked?
All right, thank you so much, Anuja. First of all, I'd like to say that we always have at the back of our mind what impact would the question or the claim have if it went unchecked. So the greater the impact, the more likely we would fact check the claim or the question. Then just to also add that we can't fact check every question or every claim. So we focus on three broad fields, which is society, politics, and justice. And the second one, the economy and human development. Then we also focus on health, science, and the environment. So those are the key areas we focus on because we realize that we can fact check every question or claim that comes to us. Yeah.
Yeah, I think we followed pretty much a similar process. So for us, just to give the audience a sense of the volume of questions, so obviously there's no limit on the number of questions that Question Hub will receive. But as an organization, we had to take a call as to how many questions we can actually manage. And so we would also receive questions in the local language in India, which is Hindi. And so we also, required some time to translate those questions and actually analyze it. So I think similar to what you said, Motunrayo, we would always have that at the back of our mind is, what is the impact that the question could have if it went unverified. So that was definitely something we ended up prioritizing, anything that could cause harm. So mainly medications. People would just type in the name of the medication and we would try and get it fact checked. And especially if we have multiple questions citing the same medication, we would definitely make sure that it was fact checked. So when we sent it across to our network of doctors, that's how we would prioritize it. We'd start off with something that is recurring and something that could potentially cause harm. And the other thing is also we would try and see if this medication is something that requires, prescription, or is it something that people can just get over the counter. because if you look at some of the sanitizers and disinfectants, it's something that someone can just buy in a market and self-consume. So we would prioritize those over prescriptive drugs, because there's just that additional level of check that comes in. For us, we also tried to fact check questions for which that weren't necessarily high risk, but it was something for which the information was available easily. So for example, there were a lot of questions in India around regulations and lockdown and restrictions, rights. So these are things that were being published by government authorities. So we had that information and we would make sure that those questions were answered before the others. Okay, the next question is on how was the fact-checked information communicated back to the people who filed these questions in the first place? Do you want to take that first, Motunrayo?
Oh yeah, sure. So what we do is that we log in the link to our fact check in the answer section. So beside every question is an answer section. So we log in the link to our fact check. Then we also share our fact check on all our social media handles, and we also promote it to ensure that it not only gets to whoever asks the question, but other people too. Yeah.
Right. Yeah. So Question Hub is the platform where the data it does not have any personally identifiable information. So we don't know who filed the question. It's all de-identified, but there is a method through which you can actually write to that person. You can just answer the question on Question Hub, and then Google has a level where they process the response and then communicate it back to the person. So yeah, we did have that direct link with whoever filed the question. Again, given the volume of questions, it's really hard for us because we download the questions in bulk and we process them in bulk. So that was quite a challenge. But to the extent possible, we did try to go back and respond to those people individually. Mission up on our website where we fact check these questions. I think we have a couple of questions on how can this initiative be scaled. I can quickly summarize that. So one is, I think just looking at the future of this project, I think there's a lot of interesting research that can come out of it. One thing that we are interested in doing is some sort of a sentiment analysis, because the processing of these questions at our end involves some level of machine learning. Just given the volume of questions that we received, we needed to build a classifier to automatically classify it into different categories like symptoms, cures, etc. So to scale it up, I think from our end, we see, there's a lot of potential to do research, because there's, a lot of insights on tone, sentiment that can come out of questions that people file. And just in terms of the fact-checking ecosystem, I think that there is definitely a need for greater collaboration, because getting this information to inform fact-checking is very useful. Often as news organizations, we're always looking for topics to cover, and this is very, very easy for our fact-checking team as well, because we had all of these vectors of misinformation communicated to us. But one of the biggest challenges is in actually increasing viewership for fact check stories. I think oftentimes the news false information that tends to spread faster than the fact checked information. So that was a challenge that we faced. Was that something similar? Do you want to add to that, Motunrayo?
No, I think you've said it all. We focus on claims that we think will have questions, sorry, that we think will have a huge impact. So yeah, you said it all.
Right. Okay. I think, yeah, I mean, our audience also has a lot of academics. So there are questions around, are there correlations between questions? There's no way to identify that, because there's no unique identifier for a question. So we literally just see the questions being filed. We don't know whether it's the same person or not. So there's no way we can actually find that out. There's also a question on, is there a way to find out whether people accept answers with specified uncertainty? We don't
No.
have access to that either. We just respond to their query and we hope that Google will respond to them. We don't know whether they're convinced by the information that we gave them or what the chain is after that. Do you want to talk a little bit about your fact-checking process? I think there are a couple of questions on what sources did you base your fact-check stories on? And as certain section of the population lost their trust in international organizations, how did you communicate the fact-check story?
All right, so just to talk about our process quickly. So whenever we're fact-checking a claim, we reach out to local agencies and also global agencies. And we always ensure that, whatever data each of the agencies provide us with are similar. Then we also reach out to experts too, to let them know which is the best data source to use in fact-checking the claim. And to also add that before we go ahead in fact-checking any claim, we reach out to the person that made the claim to ensure that they were rightly quoted. Because most times, in some circumstances, we've realized that journalists misquoted some political figures, and it almost landed them into trouble. So we always ensure that the person was rightly quoted. So those are the things, protocols or procedures we follow. So what's the other question?
No, I think that was it. I think you pretty much covered it. I would just like to add to that and say that the process of fact checking is very similar to the way we would fact check any other kind of misinformation. The process is pretty much the same. In this context, we'd also make sure that the information provided to them was localized, because the regulations, at least when it comes to COVID, have been there's been a lot of variation between countries and what different government authorities are also have as their official communication to the public. So we just make sure that the information was localized as well. Okay, I think we need to wrap up, but thank you so much, Motunrayo, and I hope we continue monitoring these questions, and I hope we have a lot more to share with the audience next year.